I have
premium.
never had any of this explained to me.
Yeah,
That's right. I
exactly. Right. So the premium is the amount of money that you are going to pay for insurance monthly for that plan. So this can be adjusted within the APTC, so the tax credit under Obamacare, or this can also be adjusted if you are disabled and you're not at that limit where you're Medicare eligible, which is 24 months. So the premium is what you're going to pay for that plan. Cost sharing is what comes into place. When you look at the plan policy, it's going to say 30% after deductible. So that is where once you reach that deductible, and we'll go into that, but once you reach that deductible, then you're responsible for that 30%. The deductible is usually a number that you would match before the insurance starts to take any sort of accountability.
Some of those deductibles are pretty high.
Yeah.
They
Yeah,
are.
they're insane.
Yes.
I've
Right.
heard stories like $10,000-$20,000.
You're right. You are absolutely correct. But usually in those kind of policies, the deductible is the exact same as the maximum out of pocket, which means that that person is paying all of that in order for their plan to work. So it really isn't working for them.
Yeah, that's crazy. Like, I don't know about you, but if I was working a civilian job when I got divorced and I had to get civilian insurance, and they're like, okay, well, your deductible's $10,000. There's no way I could get medical coverage at all. I can't, the normal person cannot afford coughing up 10 G's.
They can't take a hit like that. They just simply cannot take a hit like that.
Right. But there's a lot of brokers out there that are going to try and sell you that.
Yeah.
Why?
Most of them, in my experience,
more money into their pockets instead of actually benefiting you.
So they're assholes, basically.
Correct. They are. Yeah.
Like I said, I've seen it from the greed mill side. I've seen it from a personal injury law firm side. So
yeah, they probably
it is a greed mill.
Now this is just from my days as working as a broker in mortgages. They'll probably sell you that plan because they get compensation after they close the deal.
Yes.
So as an insurance broker, we don't get paid from the individual. We get paid from the carrier.
Correct.
And there is a specific carrier that is local here where the CEO only refers to me because they know that they're going to be taken care of. It doesn't matter if I'm going to put them on that company's policy or if I'm going to put them on a Medicare policy or a Medicaid policy. They know that no matter what, that client is going to be taken care of. And you should be able to have a broker that's going to respect you in that same manner, no matter what state you're in. So that's kind of how I feel about that.
All right.
So coinsurance, again, comes in within that cost sharing area. It is, again, like that, where it says 15% on there. A lot of companies have that 30% or 50%. So make sure that you ask these questions going forward if you're going to enroll in a policy, because it's your money on the line. It's your care on the line. And even though in today's society, if we walk into the emergency room and we just sneeze, it's a $10,000 bill, we don't necessarily want to hit that. We want to be able to have the rest of our care throughout that. Steve, can you hit the next one?
Okay.
Were there any questions? Did you guys have any questions on that?
Well, here's the thing is,
yeah.
Are there plans out there where you don't have to cough up 10,000 goddamn dollars?
There are, but you as the consumer have to pay attention to that. So it's going to say deductible. Let's say that you are enrolling in yourself and 3 kids. It's when you look at that, it's going to say deductible of $84,000. or 8,400. Sorry, 8,400. But when you look at the plan details, it's going to have an individual part within that. It's just that your family deductible is that high. So it doesn't matter who hits that family deductible. If they hit that, the entire family is covered.
I know, but $8,400.
Uh-huh.
That's that's going to be tough.
Yep. Which means that for the individual, because of the way that the insurance system works, it's $4,200 for that individual. And it doesn't matter which individual. It's a lot.
Yeah.
It is a lot. And with everything going on, there's things that we as Americans should be able to have as a right, but we are the only people that do not have the healthcare system as just a right of being an American.
All right. Now, I hear what you're saying in regards to that,
Yeah.
but the Canadian government supposedly has socialized healthcare.
They do.
And we have every single day, there is a caravan of sick Canadians coming over to America to get treatment because the waiting lists over there are astronomically long.
Correct.
England is the same.
I had an associate of mine. I wouldn't say he's a friend. He was a kickboxer back in the day. Very arrogant kind of individual, but really good. And he fought out of Windsor. And I used to go over there and give it, spar with him to get him ready for fights and stuff.
Mhm.
And he died in his lazy boy chair, waiting on a list to get heart valve surgery.
Yep.
And he was like 44.
Yep.
And that waiting, this is just secondhand knowledge here, but from what I remember, that waiting list was 16 months long.
Yeah.
So here's the problem when you involve government in healthcare, unless you've got a small, very efficient country like Switzerland or Denmark.
Yes.
They don't care.
Mm-hmm.
The government does not care about you. You are a number. It's literally all you are.
Correct.
So they don't have any interest in or concern for your well-being. You're just a number.
You're absolutely correct. And with a socialized or universal health insurance program, those are some of the caveats that we have to learn how to mitigate if we're ever put in that, or a Medicare for all. We're going to have to mitigate that as well.
Mm-hmm.
But what is the most concerning to me is that people that should have availability to insurance are either being told, no, you can't have it. No, it's not applicable with your VA. Or no, you're not able to receive it because you make that 35 cents more. When there's a lot of options within the system that nobody talks about because it does not benefit somebody else. It benefits the person.
All right.
Yeah, there's I've been to a lot of countries and I've seen healthcare work and I've seen healthcare not work. I believe that everybody should have access to healthcare. I do, but I don't think in the United States of America in particular, the way to do that is to turn it over to government. Our government is too big and our country is too big. If you want everybody to have access to healthcare, get government all the way out of it.
Correct.
And the problem in America will rectify itself.
Yes.
If we're living on rainbows and fairy dreams, of course, right? That's the way that we're going to want things to happen. But that honestly, if we're looking at the reality of things, that is never going to happen. Why? Because it takes too much money out of the government and puts the people responsible for their own care.
I'm okay with that, though.
You're right. There's a lot of people that are okay with that. Yeah. But
I'm okay with government not having any money.
Here's the thing is we have like a tidal wave of sheeple
Uh-huh.
who are let's just say they are not healthy at all,
Yes.
and they were the people who could not get insurance prior to Obamacare because they were just a health liability.
They were uninsurable under
And
the old
Well,
system.
now,
they could
hang
run
on.
through Medicaid.
Now we're all paying
Uh-huh.
for the people who are uninsurable now.
Yep. So, even if we talk about Champ VA, right, that money goes towards people who are like children, spouses, people who take care of particular VA. That money goes toward other bills within the system. It doesn't go necessarily toward making sure that our people are taken care of.
Yep.
Watch Grunt Speak live every Tuesday and Thursday at 8 p.m. Eastern. And if you want to join Pop for Supporter Sundays, go to redonkulous.com/donate and make a monthly pledge. A link is in the Meat Gazer box.